Kani kadega Batisi TV, bat pidang pet yaki kubor baman kasni, balwan rasha pi da ka orange nisan, lom so po niya fabricate shilong.
Sasisen menta ka Batisi TV haringkat ka jingitre lang bat ka CR project. Kawan rasha pi ya ka series Lockdown with David. Kabalong shibenta na ka jing persyang jongi ban lum kubor na kiliang baper halor ka jingta ya ka em ka man kha ka jilla na ka jingrung uknyang klam COVID-19 sngoba phai shipor sa ka jingkren uba David like plang bad unong yalam kaliang persya jong ka jilla u Dr. Mukul Sangma uba dairu unong sumar breu. Welcome everybody to this discussion, this talk. Welcome our honorable leader of opposition, Dr. Mukul Sangma, who is a doctor by profession, and he has been talking and sharing his thoughts and views about the entire scenario in the state of Meghalaya vis-a-vis COVID-19 and the state of affairs. He's also been very assertive that we need to work together, hand in hand, and strengthen the strength of the people. But at the same time, he's also shared his thoughts the previous time in his address about matters of concern. I'm not going to take too much time because I know viewers, listeners would definitely want to listen to what you have to say, Dr. Mukul Sangma. Just want to welcome our viewers and welcome you to yet another episode of Lockdown with David, which is a program in partnership between Batisi TV and CR Projects. So, Doctor, without much ado, may I request you to take center stage now.
Yeah. Thank you. My greetings to all of you. And then thank you to all the friends who have connected. This is the reality now. I think we can't get away from reality that during the time of lockdown, we decided to take advantage of this available technology. I think it is only appropriate. Though we are in our respective residences, at least we are able to take cognizance of our own whatever humble responsibilities we are entrusted with, and accordingly, keeping in mind the sense of responsibility, we respond to this call of duty. The state has come together, the people have come together to see that we join the rest of the country and rest of the world, because the whole world is actually gripped in this fight against this COVID-19 pandemic. And therefore, it is important to ensure that everybody is kept within the loop while we march ahead collectively in this war, and ensure that collectively we ensure the victory over the COVID-19. Now, in the meantime, there are a few issues which have drawn the attention of people as well as the elected representatives, my colleagues, and therefore, I have today taken up some issues. I have just written one humble letter to the Honorable Chief Minister today, requesting him, urging upon the government to actually, rather indicating that the decision that the government takes during the time of this crisis pertaining to levying of new tax. I'm referring to, the decision of the state government to levy additional value-added tax on petrol and diesel, which is not on expected line, because COVID-19 outbreak is a notified disaster under the Disaster Management Act 2005. So during when we are actually fighting against notified disaster, and we are trying to ensure that, okay, everybody come together and joins and share the responsibility, that means we'll have to look at all concerned, people across the whole socio-economic spectrum, and see that people are not further subjected to further economic distress and the usual hardship which they are subjected to now, which we are seeing, which is before our own eyes. And it is contrary to the expectation, because all across the globe, what is happening is that every government is coming up with comprehensive measures to alleviate the hardships of the people to which they are subjected to because of this pandemic and the associated sequel, which is the serious economic distress to which the people are subjected. So it is not the appropriate time when government, in its senses, should be even thinking about levying a new tax instead of giving relief, because Disaster Management Act 2005 vests the responsibility upon both the union government and the state government, with a clear defined role to play by both union government and the state government to provide, rescue, any support, or to put in measures for rescue and relief to ensure rehabilitation and reconstruction. So we can understand that means in this kind of situation, the people require the support for rehabilitation and reconstruction, keeping in mind, the whole economic stress to which they are subjected to, and to enable them to recover from this economic shock. So it's not a time when we should be looking at burdening the people with new added additional tax. It just fits, the whole purpose. And it goes against the spirit of the whole disaster that has been notified as a notified disaster, So I had the patient hearing to all my colleagues, and also I received lots of calls from friends from all walks of life and sharing the same sentiment. I also talked to some of the cabinet ministers, and I have to believe members of the cabinet should take cognizance of the feeling of the people and reverse their decision of levying a new tax. We should also remember one thing, all these preceding years, in the last 2 decades, when the global crude oil price was continuously, climbing the graph, people were made to bear the brunt of the high price of the crude oil across the globe. Because against the earlier system of administrative price mechanism, the government of India shifted to a dynamic pricing mechanism. So the price was revised on a daily basis based on the increase in price of the crude oil across the globe. Now, having said this, the dynamic pricing mechanism adopted by Government of India has been designed to pass on the burden of a high cost of global crude oil to the consumers, affecting everybody in the society, because whenever there is a hike in any petroleum, whether petrol or diesel, it has its own cascading effect on people from all walks of life. It has had its, multiple ripple effects. Therefore, this burden has always been passed to the consumers. Now, when the global crude oil is hitting rock bottom, it is time that the state governments should take up with Government of India and ensure that the benefit of the constant decline of the global crude price is passed on to the masses. And that is a time when they can come back with any additional levy of taxes. That is what I have suggested. So there is one part that I have shared on behalf of the colleagues and behalf of the people in the state. Then another important thing that we want to share today is regarding the concerns that we all share. The question of concern being expressed by people from different corners, including the friends from medical fraternity, is regarding the very negligible number of tests that's being conducted across the state. And if you look at the figures, then you all understand what I mean. Now, I also spoke to the director NEGRIMS to understand, okay, what is the full capacity of NEGRIMS in as far as the test on COVID-19 cases are concerned. Well, we are talking about the facility which has been provided in NEGRIMS to take up this real-time PCR test, RT-PCR, PCR test. And if the capacity of the Negrim is to be understood, the maximum test they can have is hardly 30. Therefore, there's a need to ramp up our testing capacity, keeping in mind the positive cases which have unfolded in the preceding days, and therefore see how we can actually take cognizance of the challenge associated with the spread of this COVID-19, since 50 to almost close to 80% will have asymptomatic or mild symptoms after getting infected. And that is a matter of concern, because healthy looking people who are infected, if they are asymptomatic even after getting infected, then they remain as a potential carrier of the virus. And this can be known only when we ramp up our testing capacities. And that is one crucial area where the government must focus. And I'm not seeing that that kind of, the focus which the government has to have. We must take up with Government of India to ensure that we are supported to have the testing capacity, to ramp up our testing capacity. Other tests that has been spoken about by the state government and are being provided to the state government refers to your rapid antibody test. Now, the rapid antibody test is not a COVID-19 specific test. Therefore, again, this particular test, as we embark upon testing people with this particular system, we have to again tell people what is this all about. There has to be a transparency, knowledge sharing about the different types of tests that is available. And this must be aggressively done by government. Government should have a dedicated team drawn from the medical fraternity. They can rope in people from not just our state government's members of the medical fraternity, but they can rope in people from Negrims or other, even people can talk through this similar kind of platform from anywhere, and then engage with the people of the state and make them aware of the different types of tests that is available in respect of COVID-19, which is COVID-19 specific and which is otherwise more of a test for surveillance and for research work. So these are a few things which is very important. I have shared my concern with the senior officers, particularly the senior officers of the health department, that your rapid tests being not specific to COVID-19, what happens when people start showing positive results? There will be different kinds of interpretation coming from the masses. People who do not have the complete knowledge about different types of tests and what the positive result indicates, there will be misinterpretation, and that will lead into a panic. The panic issue is very crucial. Even at the national level, across the country, what we are seeing today is that because of panic, because of not being briefed properly, people have responded to this with panic. And that panic is creating hurdles. That panic is creating the kind of narrative which revolves around the social stigma attached to any person who is testing positive to COVID-19. And that is one area which I have shared with all our friends last week that we must address. Because our past experiences, we must go on repeating these facts, that our past experiences while dealing with the HIV/AIDS pandemic, we hit the hurdles because of the social stigma attached to the disease. And social stigma attached to any disease is going to create a natural, expected human reaction. The human reaction is that because of the social stigma attached, the people who are infected by such diseases try to hide their disease. They will not come forward to get themselves tested. And that is when we will not know who is infected and who is not infected. And if we do not know that there are infected people, in spite of having infected people, then you will not be knowing where the enemy is. Therefore, we'll be like fighting against an enemy whose face you don't know. You won't even know where the enemy is hiding. So therefore, the biggest challenge before us is that the prevailing perception about the disease, because proper enlightening exercise have not been, resorted to by all of us. I must share this responsibility together with all of us. And therefore, that has to be aggressively, collectively looked at, and see that people do not get confused with different types of tests. Because the moment they say that, oh, there has been so many positive cases due to the rapid test, then there'll be a panic. I'm afraid that will, again, unnecessarily create another hurdle, another barrier. Because some people will start presuming and assuming that, okay, those people who have tested positive due to this antibody test are actually COVID-19 positive, which is not correct. Therefore, unless we have an aggressive campaign at different level, at multiple level, from bottom up, we will have a serious problem. So I would like to reach out to all concerned. Honorable Speaker has requested for a meeting on Saturday. We will all be there on that day, and we'll be sharing all our viewpoints, and we expect to hear more from the people from different backgrounds, and share their concern and articulate appropriately, so that government of the day is able to compile all those concerns, and based on that, try to have an in-depth understanding about the complexities of the problem associated with dealing with COVID-19 challenges. Then that is one part. And another important part which I want to share before I would like to hear from our friends if they have any other areas of concern which we would like to share, is that the rush that we are seeing in front of the banks, in front of the grocery shops, in front of the shops which is selling essential commodities, area which has to be addressed very, very efficiently with a proper planning. There is a need to revisit this whole approach. And I have, because shops are open for a very short period of time in a given day, there is a reason for people to actually keep the timing, resulting in convergence of too many people to the same site and ultimate rush that we see. Therefore, keeping in mind these experiences that we have gone through in the preceding days, I think there is a need to re-strategize our approach as to how to facilitate access to groceries, access to essential commodities to the people in a much more scientific manner, so that the whole planning of ensuring physical distance amongst the people are achieved. Otherwise, you will see the same thing happening. I had a picture which was sent by the people of Calcutta, where after the bank was open, there was no question of social distancing, no question of physical distancing. We are actually talking about physical distancing amongst the people. And this has to be a new norm, because as we look forward from now on for the ultimate withdrawal of the lockdown, as we think of opening up of the economies, we'll have to look at a proper plan. What is the plan, so that immediately after we start somehow staggered opening of the economy and other activities, how we would like to do things in a manner that a new normal is the order of the day, and how we acclimatize everybody to achieve that objective. As I have said last time, that the virus has entered the country, virus has entered every part of the world, every nation, including our state, unfortunately. the virus is going to stay for a long, long time. The lockdown period is only to contain and slow down the spread so that we have enough time to prepare on those things which we are talking about. And this time must be utilized for comprehensive planning so that as we move ahead, we know what is next. And we have to look at the foreseeable challenges that's bound to unfold in the days to come. And if we revisit the past, if we look at all the pandemic that has happened in this 20th century and even prior to that, you will see that, okay, the pandemic did not get over so early. Pandemic did not get over so early. And today, in this more globalized world, where the movement of the people across nations have become much more than ever before, there is a need for us to really look at what is going to be the foreseeable picture. Is this wave going to just disappear by itself? I'm sorry, it's not going to disappear by itself. It is bound to repeat itself. There'll be waves after waves of surge, probably as what we have seen, God forbid, but we have to presume and assume and prepare accordingly. So these are a few things which probably require to be discussed so that we as a community, we will understand, because this whole war is not going to be fought by the people in government alone. It is a war which has to be collectively fought with every individual, every citizen of the state, of the country being part of the whole war. That means everybody has to be in the loop. And if everybody has to be in the loop, he has to be really armored to be in the battlefield, really armored to be in the war. And that armory is the knowledge sharing, and that armory is the understanding of the foreseeable challenges, and therefore positioning ourselves appropriately to see how we re-strategize as we face the challenges ahead.
Doctor, you're known as a person who actually does not really paint a grim picture about any situation, however bad it may seem. But from what I gather and the way you're describing things, it doesn't really look very bright. After having heard you, today the government has decided that the industries will start, they'll start functioning, albeit within certain norms and guidelines. Construction activities will begin, stone quarrying will begin, and various other self-employed projects will be permitted by the government within certain frame rules and guidelines. Do you think we are ready to actually implement that, or it is rather premature on the part of the government?
You see, I think we will have to be very practical. We have to be realistic and scientific in our approach. Now, knowing things of the likely challenges ahead should not be seen as something which refers to painting a grim picture. We are looking at what is the likely reality that we are going to face, because reality has to be understood based on what has happened in the past. We learn from the past. Even in the past, why there has been more death? Why? Because there was a presumption and assumption that let us refer to 1980 pandemic. There was a similar kind of situation when the authorities and the people assumed that the pandemic is going to go away, but it didn't happen. From beginning of 2018 till the end of 2020, it was a long 2 years. And keeping in mind that particular time and now, it is very different. The whole globalized world has created a different kind of advantage for all of us to reach each other very fast. The world has become smaller, so it's more like though we have international borders, geographical border because people keep on moving. The number of people that move across the countries have become huge. So earlier the movement were very restricted. Movement were more through the sea voyage, not so many through the aeroplanes. But the modern era, you have seen, many airlines have come up with that affordable, pricing. So traveling by air has become affordable to almost everybody. The access to income has actually become much more accessible to many. That means people have reasons to spend for traveling because livelihood is associated with traveling. So traveling is not only for luxury, traveling for necessity. Air travel also has become a necessity. Therefore, the movement, interstate movement, then international movement, all these things are going to create new dynamics. This is the new dynamics of the present global world. Therefore, we have to understand that, okay, if the virus has spread to all parts of the world, why was it so fast? Why was it so fast? We understand why it is so fast. And you would also appreciate the fact that, okay, some areas which has become epicenter like New York, why is it that, okay, New York was the first badly hit cities amongst the cities in USA? There are reasons which we all know. So therefore, the virus having reached every part of the world, virus is going to remain. The only way to defend is, of course, to treat patients with the medicines which the scientific communities are working on 24/7. There are multiple teams who are working on this, and we hope that they find some answers. And at the same time, the vaccine, which ultimately is the ultimate shield to defend all our fight against various diseases, where only when we ultimately caught hold of some vaccine, and vaccine against any infectious disease is crucial to ensure that, okay, it doesn't have that kind of ramification on the health system that leads to a health crisis. Now, before the whole global community, there are twin sequels of this pandemic. One is the health crisis, and another one is the acute economic distress to which the people are subjected to, which has the potentiality of running into foreseeable economic depression. So there are challenges before us. Therefore, these challenges having understood, we'll have to look at how the government of the day work together, the state and the union government and all the national governments across the globe, how they work together to achieve that objective of finding the answer to challenges of treatment. That means finding the medicine specific to COVID-19, and also to ultimately have the vaccine to prevent the disease from striking. Now, you see, there are two things here. One is, of course, the need to have the economy to be open. Now, opening of the economy, it has to be well planned, and how we, put the whole planning for everybody to understand is very crucial. That's why I was sharing my concern, which is very realistic, is that we have to actually make everybody aware of the plan. That means there has to be complete transparency about the plan that we have. And obviously, we'll have to ensure that, okay, we slowly withdraw the lockdown and slowly open the economy. But it obviously will have to be in a staggered way. And at the same time, it has to be comprehensively planned. We are seeing one thing, that even in the countries which had the first spell of the wave of the COVID outbreak, and subsequently so the positive outcome of the containment, having reason to believe that, okay, they have been able to contain, therefore opening up of the economy, and then suddenly seeing new cases surging in those areas. So there will be similar kind of situation if we don't do things with a proper plan. Therefore, proper plan as to how it is being planned to be open slowly, in what manner, is very crucial for everybody to understand. Lest there is a kind of situation where, because of some slightest of sense of complacency and therefore the associated so-called miss between the kind of miss between the cup and the lip, we ultimately land up again seeing a situation which we don't expect. That means ultimately seeing positive cases coming up from here and there. Another important point which you have referred to is, obviously and precisely, have we been able to really locate the source of the transmission of the disease in as far as the first positive case of COVID-19 in the state is concerned? Have we been really able to locate the origin of the transmission chain in respect of our state? I'm afraid, and that's why I have shared earlier also, that government must look at all the possible sources of transmission in respect of the first COVID positive case. And unless we do that, we might and we will deprive ourselves of the vital information about the actual origin of the transmission of the first COVID-19 positive. And unless we direct our attention to that, and unless we are sure that, okay, we have known where the disease has been transmitted from, we need to be still very, very careful. And that's the reason why I'm talking about ramping up the test. There is a need to actually look at all those possible contacts and engage in aggressive testing. And when we are talking about aggressive testing, I'm not talking about, the antibody test, the rapid test, because that is not COVID-19 specific test. That will only indicate as to whether a person who is subjected to tests had any recent infection or not, or any infection in the recent past. It will only indicate that, and any such result only will indicate, okay, recent infection. A person to have been exposed to any recent infection of any coronavirus family of the viruses. It is not COVID-19 specific. Therefore, there is a chance of people having a different kind of, or rather a wrong interpretation about the positive cases, and the result will be that there will be unnecessary misinformation resulting into panic, which we have to avoid under all circumstances, and ensure that people are very well enlightened on the different kinds of tests available before us, and the different kinds of tests which we are actually subjecting our people to in as far as detecting the cases is concerned.
My colleague Banjop from Press Trust of India wanted me to ask you on his behalf. He's in an area which has very low connectivity and can't reach out and connect with you. He says 5,000 plus suspected carriers in all, yet the pace of testing done is very slow at merely 100 tests a day. What is the LO's opinion on this? And we have testing machines lying idle in ICAR. Whether the LO has made a demand to use the available machines to ensure expedient tests.
In fact, since it's a notified disaster, when we talk about resources include the manpower, material, and all other resources, including the access to all those facilities. Now, therefore, all the resources which is available before the government must be put to use. And in this instant case, because of the gravity of the situation revolves around the number of the people who are reported to have come into close contact with the people who have tested positive, and also the people who have come close to those people who have been close to the people who have tested positive. That is very important part. And another part is that I think there is, again, it comes back to this whole social stigma. Now, unless we test and unless we subject all those names which have been compiled, unless we subject all those people who are in the list of the potential people to have been considered vulnerable, the people who are considered to be vulnerable, they can always classify and prioritize. Okay, the first priority A, priority B, priority C, based on the level of vulnerability, and ensure that every one of them is subjected to test and subjected to a specific test for really knowing whether the persons have been infected by COVID or not. Not that recent infection or not that rapid test. Rapid test will give a very, I must say, a rapid test result will only confuse them more. Confuse the whole machinery which is presently in the helm of affairs. I understand their limitations also, and I understand what is going to happen. It will only confuse all of them. What happens if they are subjected to, rapid tests, the antibody tests? If they also positive cases, that is not COVID-19 specific test, no. Therefore, a COVID-19 specific test has to be actually ramp up. And if you are talking about such a huge scale, then when are we going to complete? Therefore, get all the resources, get more testing kits. Ramping up means you require to have more testing kits, more capacity to test. And we must utilize, NEGRIMS. I discussed with the director NEGRIMS, and then they are capable of increasing their testing capacities, provided they have the additional support. Now, there's a reason for Government of Meghalaya to take up with Ministry of Health, Government of India, and also to take up the issue with ICMR. They should not wait for the regular advisory coming from ICMR, which is general in nature. Certain measures which is required to be taken based on the exigencies and the challenges associated specific to this particular area, I think they must prevail upon the concerned authorities of Government of India and all those arms under the Government of India, and ensure that, okay, you have enough testing capabilities, and therefore you are ramping up your testing every day on a daily basis. You cannot make people wait and wait and wait, because they will be subjected to lots of mental anxiety. See, I have shared that day also. People will unnecessarily be subjected to lots of anxiety, leading to psychological stress, which is not really good, because psychological stress is a precursor to many critical ailments, including hypertension, diabetes, and potential to have a long-term psychological disorder, which will actually have a ramification on the community health as a whole. Therefore, we have to be very cautious. Even if there are people who are considered vulnerable and they are not subjected to tests, as a human, the person concerned will ultimately be subjected to all the mental anxiety, then the associated mental depression. It is not really good. So the waiting should not be long, and if that is to be done and ensured, you have to ramp up your testing capacities.
Another colleague, Afaq, from the Shillong Times. In fact, the Shillong Times had run a story a few days ago about Barpeta Medical College expressing concern in the samples, in the nature of the samples sent from Meghalaya that were done via the door-to-door collection method. So Afaq has this question. He says, since we have 11 cases and history of the origin of the pandemic is not yet known, what suggestion do you, as a professional doctor, have for the state government to help contain this problem?
You see, when we are at war, shared this one earlier also, intelligence collection is crucial. And here also, since we want to actually really know the source of infection, the same thing applies here. Intelligence collection. Now, intelligence collection in our medical profession relates to proper history collection and scrutinizing those history collection and collaborating all other likely chances. There's a robust disease surveillance mechanism across the country. We have a robust disease surveillance program, and that is the reason why we have been able to very successfully fight against number of infectious diseases. Be it, the eradication of smallpox, or be it also the fight against polio, and even fight against your other infectious diseases, including the challenge of the HIV/AIDS pandemic. So it is not something new. We have a robust disease surveillance system in place. The integrated disease surveillance program that the country has its own counterpart across the state. So there's a format, there's a mechanism, there's a methodology, and therefore those methodology must be stringently followed and adopt professional approach. And then you are going to have all the informations. You're going to be able to reach to the source of the first source of the infection, and that is what is required. In absence of that, it'll be definitely depriving. You will have a self-deprivation of the actual information. So it is like any other war. The robust system which has to be put in place for intelligence collection.
To supplement
swab. I think there was a concern about the false negative. Now, why many a time we say the RT-PCR test, though it is specific to COVID-19, it is not 100% accurate. There are, the trust factor of all the positive cases revolves around just between 50 and 60%. It is not going to give you 100% accurate result. It can also have false negative. False negative revolves around various factors, one of them being the sample collection itself. Now, how trained are those people who have been vested with the responsibility of collecting the swab? How are they collecting? Is it under scrutiny of some experienced person, or you're just sending randomly many people who have been just given an hour of training or something like that? And it also again is determined by the mindset of the person who is collecting the swab. If he himself is not really committed and have that apprehension of himself getting contracted, maybe because of various factors, including not being protected through appropriate PPEs. Those can be the factors also. We have to have complete understanding about the factors which can result into a faulty collection of the swab sample itself. I have seen it during my course of study. Even the students, when we are trained how to collect the swab samples, some people are very, reluctant, very scared kind of thing. Even when we go to see some patients who are in isolation ward, some of the students, our batches, they will always find some reason not to go. There's always it's a mind game. There'll always be some factors. Now, if these people who are in the front lines are not protected with proper PPEs, you can understand what is going to be the commitment level and the confidence level. Confidence level and commitment level come together. In spite of the commitment level, if the confidence level is diluted because of the factors which is beyond the control of the people in the front line, then you have a problem. And that is also one concern which I have heard. In fact, I have heard from the media reports itself. So those are things which the government has to correct. It is serious. It is serious. Now, if the swab collections are faulty and that concern has been expressed and that is available before the government, have the government taken recourse to taking corrective measures and ensure that it is not repeated? Otherwise, as I say, people who are carrying the virus, in spite of carrying the virus, because of faulty swab collection, if they test negative, then what happens? Then a potential infected person who is going to infect others will be having that false confidence that he's not infected. You can't blame him then, because the false confidence that one has tested negative because of whatever reason, though he is actually infected. That means we are only going to have that kind of infected people mingling around in the society, and thereby ultimately seeing a kind of surge which we don't otherwise expect.
Which brings me to a supplementary kind of a question, which is by Ivan from Meghalaya Guardian. Her concern, by hearing people expressing their concern to her as a news person, is that when it all started, when Meghalaya started, when COVID-19 entered Meghalaya and became public, everything was attributed to the son-in-law of late Dr. John Silo. He, however, has tested negative twice. People who have come in contact with him, all 29 of them in Imphal have tested negative. But the government has at no point of time tried to clear his name. His name is still doing the rounds. There are people, and there are even people from within the government that still quietly point a finger at him. So don't you think this is casting a very direct stigma on the person who, having tested negative twice, going in for the third one shortly, is being blamed for something which he himself doesn't know? What could be a solution for that, to at least put rumors to rest?
Yeah, you see, it's a question of jumping into conclusion without really looking at all the possible sources of transmission. I put it that way. One important aspect to everyone who is required to really search for the source of transmission is that we should never jump into conclusion without looking at all possible sources of transmission. And here, in the instant case, it has been made available to the government, the authorities, and to all of us that the initial interpretation or the conclusion that the possible source of transmission must have been from the family because of the travel history. Now, one thing I always would like to see is that, okay, if we take things so lightly and always say that, okay, this is it, and then don't look beyond, it's like a kind of trying to, look at, okay, karna hai to kar diya, that usual approach, chalta hai approach. This is not a kind of work which can be addressed with this chalta hai approach attitude. There is a need to be more aggressive in information collection. History is very important. Now, okay, the travel history, whether the person concerned has really followed the protocol stringently during the time of home quarantine or not, that is very important. If we know, because the moment I know somebody is in home quarantine, I try to talk. How are you staying? How are you, ensuring that the protocols are being stringently followed or not? Because it's very important. Now, it should have been that we try to know about whether the person in question with the travel history was stringently following the protocol or not. And if there is a reason to really indicate that the person concerned has not stringently followed, then ask further questions. And who are the likely people who must have come across in close contact with the person concerned? And therefore, don't leave the other possible sources of transmission unattended to. Keep on looking at those other options also. That is very crucial. I wanted to know, yes, how many times in the instant case, the son-in-law had a travel history. Therefore, whether he was tested or not. He was tested. And I'm told that he was tested thrice, not just twice. I don't know whether I'm correct or not, but I'm told that he was tested thrice. Now, if he has been tested thrice and has tested negative, then look at other corroborative chances of anybody who is likely to contract the disease if they have come in close contact with the same person. And we have the history of him traveling to Manipur. Therefore, all those people who have come into close contact with him and who are suspected to be, vulnerable have been also subjected to tests. Now, if these tests also have shown negative results, then there is a very high level of suspicion that has to be taken into consideration about source of transmission from other sources. That means there is a need for us to search for other sources of transmission, and that becomes very important. Otherwise, the virus will still continue to hide and will not know where the virus is hiding. We have to only engage in one thing: communicate, and make people talk about this disease and ensure that nobody attaches social stigma. Anybody who is thinking that he has come into contact with COVID-19 positive, I appeal to them to come and declare and then ask for testing. We will not allow anybody to attach social stigma. And that is how it should be. Anybody who has reasons to believe that they may be also infected, they must come voluntarily without being asked. Even, I don't know, God forbid, but many friends have come from outside, return upside, after, the outbreak has taken its pandemic nature. Therefore, in the event of anybody thinking that, okay, maybe he must have contracted, and because there are most of the infected people remain asymptomatic. And asymptomatic people, if they develop certain amount of mild symptoms, even though they feel that they have this virus, because of that inhibition, mental inhibition, due to that social stigma, they will not come forward. But it is my ardent request to everybody to tell them that, look, come, get tested. No worry. I will call them the people who are tested positive. Let them come and stay in my house, man. I'll take care. I'm a medical professional as well, and I'm a social worker. I'm in public life. Anybody who tested positive, I want to demonstrate that, okay, I can keep him in the, if he is having mild symptoms also, I can keep in one of the rooms, take care of him, and prove to the world that even if there is one positive case in the house, if we enlighten people how to take care of them, this COVID-19 will not spread the way it spreads. Our idea is to slow down the spread, contain the disease as much as possible, so that we are all prepared to somehow confront it if there is any likelihood of next spell of surge. We ultimately buy time so that we ultimately get vaccine and then people are safe.
So, final closing question to you in one line. If the government asks Dr. Mukul Sangma to lend his experience as a medical practitioner, as an able administrator, would you be willing to come forward and help the government for the people of Meghalaya?
I'm already doing it. I'm already doing it as a leader of the opposition. I'm already sharing my concern. I have got response. In some cases, I have not got response, but it's left to the wisdom of the people in authority. That, okay, whatever suggestions I'm giving, let them take into cognizance. Like I said, why do you have to impose levy a new tax now? Why? Because it's a time to give relief. It's a time to talk about how to alleviate the sufferings, the kind of serious hardships to which our people are subjected to. We also talked about, okay, we are talking about the general relief. Now, many of the elected representatives also have submitted a collective representation. Now, the expected line has to be to read between the lines why these elected representatives and people are talking about general relief. Because when there is a general relief, I talked about that, the rush. Why people are rushing to the bank? Just to get that 500 rupees, which have reportedly been deposited to the respective bank accounts of the women. What has happened? You saw a rush before the bank. Now, why are people compelled to go to bank? Because they need cash. Why do they need cash? Because they need to buy essential commodities. They need to buy food. But instead of giving cash, what is more important today is that provide people general relief in the form of food items. And that is what we have done in the past. When there was a ban called by GNLA, we gave relief, we gave general relief. This is not the time to tell people, look, I'm depositing in your bank account, go to the bank and get money. Because indirectly, you are only compelling people to come out of the house and to overcrowd the bank premises, the shop premises. That's why they have to line for getting a few kgs of rice and dal and food stuff. So these are few things which, when we are sharing with the government, must be understood why we are. Even the Disaster Management Act, based on which this COVID-19 outbreak is a notified disaster, is that the section 61 says that there should not be any discrimination. Now, if you are talking about, okay, giving food only, the free rice only to the card holders, what about the others who do not have the card? Indirectly, you can interpret that, okay, that means you are classifying people. So let us not do that. That's why please try to understand the concerns being expressed by all concerned. These concerns are being expressed on behalf of the people, not on my behalf. I am only speaking on behalf of the people. So the whole dynamics of this conversation amongst ourselves, between the people who are in public life, and the leaders of different civil society organizations, the leaders representing various community leaders. I think these are very important for us to take cognizance of and then respond accordingly. It's a time to demonstrate empathy. It's not a time to actually disregard any constructive suggestion just for the sake of rejecting due to political consideration. It is important for us to see that, okay, we have decided, we have all, taken strong resolve to be together in this fight. We are all one, and as a collective team, we must face this challenge.
Well, that was enlightening. It was nice. It was also encouraging. Thank you so very much, Dr. Mukul Sangma, the Honorable Leader of Opposition, for sharing your time to come join me via the virtual world using technology to address the people of the state and to share their concerns, and also extend your ideas to the government and those in the front line, at the same time encouraging people to stay away from stigmatization, to have faith, and to move on forward as one big family. Thank you for sparing your time at this episode of Lockdown with David that is
So one
being
last
aired.
word. One last
Yeah.
word. One last word.
Okay.
Yeah. So we are all staying in the house. So the whole usual share of words is that, okay, stay at home, stay safe, but utilize this time to take care of the health, take recourse to the regular physical fitness regime at home without equipments. This is what exactly I also used to do. Even while I was a student in the college, I never had an equipment, but I ensured that all the exercise that one has to have to remain physically fit, so that we condition ourselves, physically, is very crucial. I request all our friends utilize this time to take care of physical fitness, and also to ensure that we take advantage of these to spend time with our loved ones. Thank you.
Thank you, Dr. Sama, and thank you all for watching this episode of Lockdown with David. I wish that all of you stay safe, stay home as much as you can. To my colleagues, an earnest appeal that we all try and stay safe. I know the job that we do is challenging, but I also know that there is someone above that protects us. And I appeal to all of our viewers that pray to the Almighty for our beautiful people, our beautiful state, our beautiful country, that we come through this as champions in a fight where everybody plays their role actively. Thank you very much. Good night. You're watching Lockdown with David on Batisi TV, powered by CR Projects.
Thank you.